Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, July 22nd, 2020. Joining us today is Mayor John Tory and Dr. Eileen de Villa, Toronto's Medical Officer of Health. Dr. de Villa will take us through the monitoring dashboard, which is on the city's website at toronto.ca/COVID-19. Mayor Tory.
Well, good afternoon and thank you, Brad. Today marks 2 days since the Danforth tragedy, which forever changed our city. 2 years ago, a senseless act of violence claimed the lives of 2 young people, injured 13 others, and impacted the lives of many others, both in communities close to the Danforth, but across the city as well. The pain of that awful day continues to be felt by everyone who loves this city. This morning, I joined members of the Kozis and Fallon families for a ceremony to commemorate 2 years since the Danforth tragedy. This weekend, I called families of those we lost and those who were injured to make sure that they knew that the people of Toronto were thinking of them as they continue to heal. I was reminded in those phone calls how long healing takes and of the fact that even when there is healing, there are almost always scars. This morning, together with survivor Danielle Kane and Councillor Paula Fletcher, we laid flowers in front of 2 trees that we planted last year in Withrow Park in memory of Juliana Kozis and Reese Fallon. These were the 2 young women that lost their lives. We also honored the 13 people from all over Toronto and the GTA who were injured as a result of this violence and who survived this incident, though in some cases not without ongoing after effects, some very serious indeed. Ali, Danielle, Dempsey, Donnie, Junyop, Joanne, Lima, Melissa, Miranda, Nikita, Nicholas, Samantha, and Stamatis. They are all in our thoughts today. We continue to wish them well in their recovery. I would also like to acknowledge the first responders who demonstrated such bravery and skill and sensitivity in the face of that great challenge on that day in 2018. I saw it with my own eyes. I was there. We cannot forget the work of the Toronto Police Service, of the Toronto Fire Service, Toronto Paramedic Service, TTC Transit Enforcement Officers, and our hospital personnel who were in place and ready to help those who needed help on that terrible night. And of course, there were many ordinary citizen responders, first responders from among us who did what Torontonians do when tragedy strikes. They help out in any way that they can. And to them, we owe a huge debt of thanks, and we should remember that again on this day 2 years later. Once again, my deepest sympathies to those who were impacted by that tragedy and those lives that were lost. Toronto is with you during this time and will continue to support you. Human beings, and of course communities made up as they are of human beings, we're all resilient. We heal based on hope and we heal based on support from others. COVID-19 has made it especially difficult as we couldn't gather today in a large group and could not show our support in that way to one another as we do so well and in such a genuine manner in this great, compassionate city of ours. We have demonstrated over and over again how we come together in a time of need. And today is no different. We're all in this together in supporting each other following the Danforth tragedy and in dealing with the serious human impact of the current pandemic. So part of that over the past few months, families and loved ones in long-term care homes have been very worried about the health and well-being of their loved ones. It was one of the hardest hit areas, tragically, during this pandemic. Families have not been able to see their loved ones in person, sometimes for many months. And residents in long-term care homes have had to go months without seeing their loved ones in person. I want to thank everybody for their sacrifice and for their patience during that time. I know it's been especially difficult and lonely for residents. And in the city's long-term care homes, we have 10 of them, we are working to allow visits again now that the provincial restrictions have been lifted. Right now, there are no positive cases of COVID-19 among the residents living in long-term care homes operated by the City of Toronto. As I said, there are 10 of them. This is good news and something we've not only been waiting for, but something we'll work hard to maintain. Since June the 18th, City of Toronto long-term care homes have been supporting residents with outdoor, physically distanced visits. Following the province's announcement on July 15th 2 visitors are now able to visit as long as the long-term care home is not experiencing an outbreak. And starting today, indoor physically distanced visits will also begin. This means that 2 visitors at a time are able to schedule an indoor visit as long as they are following the guidelines that are in place, including testing negative for COVID-19 within the past 2 weeks. Staff at senior services and long-term care are continuing the hard work of protecting residents and ensuring that all safety precautions are being followed as they welcome family members back into the city's long-term care homes. The health and safety of residents and clients, their families, and the well-being of all of our staff members is and will continue to be our priority. We need to do this right to protect everyone and to stop the spread of this virus. And so I encourage anyone who's considering visiting a loved one at any of the city's long-term care homes to regularly check the city's website for the most up-to-date information. I hope that residents living in long-term care and their families see this as a step forward, and I know our city officials are working hard to make sure that as many protections are in place as possible ahead of any second wave. I continue to urge apartment and condo buildings to adopt mask and face covering policies in the common areas of their buildings. I should tell you that I had a positive response from the Greater Toronto Apartment Association, who are committed to doing their part and encouraging their members to do so. In order to assist them, we have created Toronto posters, City of Toronto posters on our website, posters like this, that buildings can easily download and print to post in the common areas of their buildings to encourage mask usage among their tenants and their staff. I want to say thank you to all the buildings and all the owners and all the condo corporations who are working to adopt policies requiring face coverings in common areas, such as the lobbies and the laundry rooms and the elevators of residential rental buildings and condos. This is the right thing to do, and I'm confident that it will help us to stop the spread of COVID-19 as we move towards a greater reopening. For the last several months, Toronto residents and Canadians across the country have gone above and beyond to support one another. Responding to the challenges of COVID-19 has taken a united effort, and one that will continue as we continue with the reopening of our own city. Today, I'm pleased to announce that Toronto is joining Canada United, a movement to get Canadians to shop local and support businesses in their communities. This initiative, which was created by RBC, brings together the national network of chambers of commerce and boards of trade, Canadian business associations, and more than 50 of Canada's leading brands to give local businesses the support they need to reopen and to stay open and, in fact, to thrive during these challenging times. Canada United will bring together Canadians from coast to coast in an effort to support Canada's local businesses. And RBC will contribute 5 cents to the Canada United Small Business Relief Fund. So I hope you'll take a chance to visit canadaunited.ca. No, it's called gocanadaunited.ca. I hope you'll take a chance to visit that website for more information on how you can get involved and support these businesses. And I can tell you this is just one of the many ways in which we can all support small business who are and which are the backbone of the economy of our city. We know we need to do everything we possibly can to ensure that small businesses do in fact survive and continue to be successful. That is why we expanded Digital Main Street during the course of the pandemic. It's why we started the Shop Here program, created the Business to Support Center, the Business TO Support Center, and it is something that has literally helped all of these initiatives, thousands of businesses during the pandemic, and those supports will continue. The small and local businesses that make up our main streets have faced difficulties since the early days of the pandemic, and I encourage residents to participate in these initiatives and use the hashtag Canada United to demonstrate your support. I can indicate there is more to come by way of city-wide initiatives to encourage people to shop local, dine local, and support local businesses once we are well entered into stage 3. I know that we can get together to support our local businesses, so let's do it. We're making such progress in this fight. I know the vast majority of people are committed to working with us to protect public health and to continue that progress. But as Dr. de Villa will outline in her remarks today, we are seeing a creeping increase in younger people, for example, testing positive for COVID-19 here, and we're seeing other things that are happening with some of the numbers in other jurisdictions. I know, we all know that people have COVID fatigue. Heavens above, we have it too, because there are things we can't do as people who live in the city together with you, and that it is the summer and that people want to have fun. But let's focus on something very important. COVID is not over. There is no summer vacation from COVID-19, much as we might want to have one. So while the urge to party and get together with friends and family may be strong, especially with younger people here and across the province, please keep following public health advice. Keep your distance from people outside of your social circle. Wash your hands often and don't touch your face. Wear a mask in public places or any other time that you can, in addition to being in public places. I know that sometimes we can be inclined to tune these messages out because we've either heard them too often before or because we feel young and invincible. Please listen. I know that some people were mocking Premier Ford when he made this plea to people yesterday, and they'll probably do the same to me, but we are doing it because we have been told by the experts who we've relied on so completely and to good benefit in terms of how we've been successfully able to fight this virus off so far. We've listened to their advice, which is we have to stay the course. We have to do better than staying the course. This is a deadly virus, and though many people survive having it, it could have a long-lasting effect on your health and the health of your friends and family. And so if you're not necessarily thinking of yourself, you should think of all the others that are close to you, and even people who aren't, that you just encounter in your own day-to-day travels. We need your help to keep everyone healthy and to get through this reopening without triggering a major spike in new cases, fueling a larger second wave. When we have conquered COVID and it is safe to gather together again in large numbers, believe me, the moment will come when it's time to party. I've already promised we will have, and we will, a substitute St. Patrick's Day held at whatever date in the year it is safe to do so, because people have relied on the fact that I made that commitment, and I want to make it because it'll be fun. But we have to wait for the right time. In the meantime, follow public health advice. And on that note, I will ask the dispenser of that wise advice throughout, Dr. Eileen de Villa, to give her report for today.
Thank you, Mayor Tory, and good afternoon. Over the past 2 days, there have been 58 new COVID-19 infections in Toronto. To date, 13,584 people have recovered, an increase of 52 since Monday. COVID-19 has affected all of us in our own ways. However, some of the most devastating impacts thus far have been experienced by our loved ones living in long-term care and retirement homes. One of the first measures to protect staff and residents in these settings, and in many ways, one of the most difficult, was stopping family and friends visits. This was a critical step to reducing the chance of visitors inadvertently bringing the virus into these settings. However, the impact of restricting access to our loved ones has been particularly hard. As Mayor Tory noted, effective today, indoor visits to long-term care and retirement homes are now permitted with a 2-person limit. As we've witnessed throughout the pandemic, we need to be vigilant about making sure that we do everything we can to stop this virus from spreading in these settings. As I've shared many times before, my team and I continue to observe and learn from the experiences of other jurisdictions who are ahead of us in their outbreaks. We do this to apply these lessons locally to protect your health. Recently, the media has reported an increase in COVID-19 activity in many jurisdictions that reopened just a few weeks ago, like Alberta and British Columbia. These jurisdictions have noted that their residents were no longer having safe social interactions and have confirmed that COVID-19 activity has been linked to young adults who contracted this virus at celebrations at private homes and in bars and restaurants. Locally, while our overall COVID-19 case numbers have decreased, new infections are still being reported every day. We are now seeing more 20 to 39-year-olds getting COVID-19 compared to earlier in our outbreak. I'm very concerned about this, given recent trends amongst this age group in other jurisdictions. I'm also concerned because I've heard that many people say that they believe that COVID-19 is over. I'm here today to tell you that this is simply not true. My message to you is that we must remain vigilant. Today, I will walk you through our updated COVID-19 dashboard to show you why we must approach stage 3 of reopening our city with caution. I know this news may be difficult to hear, but my job is to give you the information you need to protect your health. And as much as I know we all want to get back to something resembling life before COVID-19, we're not there yet. So first, our overall dashboard status remains yellow. Some good news is that our overall health system capacity and our public health capacity indicator categories remain green. In addition, the average percent positivity on COVID-19 tests is declining, and new COVID-19 hospitalizations and outbreaks are also declining. This means that our public health measures are having a positive impact. However, there continue to be challenges experienced at the provincial labs with delays in test processing times. And while overall COVID-19 case numbers have generally decreased in our city, new infections are still being reported each day, and we have plateaued with our 7-day moving average of new COVID-19 cases remaining consistently in the high 30s and low 40s. We have all worked so hard to get here, and I do not want to lose our progress and our many sacrifices. This means we still need to continue carefully moving forward and observing the experiences of others who have reopened before us. Around the world, the evidence points to the importance of a slow and steady reopening. This is why we asked for the province's Stage 3 order to consider enhanced safety measures for bars and restaurants, measures that apply lessons learned from other cities around the world. We continue to assess and reassess our local circumstances and will continue to identify ways to further enhance Stage 3 orders based on what we know today from the best available science and the experiences of other jurisdictions. My team continues to monitor our local data to inform our action as we move forward. We were pleased to launch new individual-level COVID-19 data on the city's open data platform earlier this month. The positive response and interest in this data has been tremendous. In an effort to ensure ongoing data quality, I wanted to let you know that we will not be publishing updated individual-level data today, as my team is adding a new field that includes a unique identifier for each record, so that those using the data will be able to track the same case information from one week to the next. So the next update will be on July 29th. This weekend marks 6 months since we had our first positive case of COVID-19. At that time, it was hard to imagine how a pandemic would impact our community and the whole world. I know it has been really difficult. Through this adversity, though, our community has rallied and worked together to support and care for each other. It is a reflection and testament to the fabric of this city. It gives me hope, and it makes me proud to be a Torontonian and to serve you as your medical officer of health. Finally, I wanted to take a moment to remind everyone of Ontario Health's pop-up COVID-19 testing clinic taking place today and on Friday from 4 p.m. to 8 p.m. at the Christian Centre Church at 4545 Jane Street. Thank you once again to our colleagues at Ontario Health for this important initiative. In closing, please remember that each of us plays an important role in reducing the risk for others and protecting our city. So please, wash your hands, watch your distance, wear your mask, and please continue to take care of each other. I'll now hand it over to Brad.
Thank you, Dr. de Villa. We have several staff on the line to answer any detailed questions reporters may have, including Paul Raftis from Senior Services and Long-Term Care, Marianne Bedard from Shelter Support and Housing, Carlton Grant from Municipal Licensing and Standards, and Jody Callan from Transportation Services. First question is to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thank you. My first question is for Mayor Tory. We heard that the province would be announcing this week how it plans on divvying up that $7 billion it's receiving from Ottawa, and we are still waiting to hear what funds the province itself will be giving municipalities for the COVID-19 pandemic. So have you heard anything yet on that front, and if Toronto will be getting the $1.35 billion it needs?
We haven't yet heard any confirmation that we will get as much as we need to fill the $1.3 billion gap we have, but we have heard that they're working very hard on that and that we should expect to hear fairly shortly. So we will be presenting a report to the City Council next week in anticipation of the City Council meeting, and it will tell the public and tell the Council everything we know up to that point in time, but this is going to be something that is going to be a work in progress as the two governments, federal and provincial, sort out their arrangement with each other, and then in turn as the province tells us what we're going to get. But the discussions certainly that we have had have been very positive, and I'm encouraged by the fact that they know what the scale of our problem is, they know the elements that have made it up, especially on the transit front, and that relief will be forthcoming.
Thank you, and my follow-up is also for Mayor Tory. It's regarding last weekend's inspections of bars and restaurants. So it was billed as increased inspections would be done, but when we followed up yesterday, we learned only 26 inspections were completed and that they were all complaint-based. So unless inspectors aren't following up on every or even most complaints made, they were really just doing their jobs. So why aren't or weren't random inspections done to ensure that these bars and restaurants are following emergency orders? And wouldn't the pandemic be a worthwhile time to launch repeated blitzes similar to the parking blitzes launched by the city?
Well, first of all, I think I've said many times, whether it's parking blitzes or pandemic blitzes, we don't instruct law enforcement people as to when they carry out their enforcement activities or how they carry them out. I will say that I think an enhanced series of observations by these people, I think, the assumption is because that's the number of complaints that were received and that's the number of inspections that were done that are formally recorded, that the rest of the time people are going around with their eyes closed or not noticing things that they should notice. And I don't think that's the case. I think these people are on the job all the time, and we've had increased numbers of people on the job on all fronts, the beaches, the parks, and for that matter, the restaurants and bars. So that I'm optimistic that we're doing as good a job as could be expected among a very, very widespread number of licenses spread right across the city, and that we do rely on the public to let us know about particularly serious examples that they see, and we do follow up on those. But I think mostly it's going to be that those kinds of inspectors and officers are going to keep their eyes and ears open, as they always do, Fortunately, most of the time when our law enforcement people are out on the job, they're not actually responding to calls. They're watching what's going on. They're waiting to see if things come up. And I think in this case, at the same time, they're watching very carefully what's happening. So we monitor this day to day in terms of them reporting back to us, and I'm sure they'll decide if more rigorous enforcement is required, that they'll carry it out.
Okay, thank you. We go next to Francine Copen from the Toronto Star. Francine?
Oh, hi, good afternoon. What we know about COVID-19 has changed a bit since the pandemic began. We know that the disease is less severe in children under 10, and that, for example, UV light may play a role in inactivating contaminated surfaces, like the surfaces you might find in a playground. I'm wondering whether this city, given that, this lockdown on playgrounds has lasted so long and we're in the middle of the summer in a city where a lot of people live in small apartments, whether the city is looking at ways to perhaps open playgrounds or petition the province to allow playgrounds in Toronto to open.
So thank you, Francine. Why don't I, take your question and suggest that you're quite right. We're talking about a new virus, and you mentioned at the beginning of your question that we've learned a lot about this virus. And I do think that one of the things that we have learned is that the primary mode of transmission is through what comes from the respiratory droplets and secretions of people who are infected with COVID-19, and it's direct contact with those secretions, which are, of course, microscopic. You can't see them. So, but it is still with direct contact from those secretions, less so from surfaces. That's not to say that it can't happen, but it is less of a concern than it was, I would say, at the beginning of the pandemic, when we just simply did not know as much about this virus because the virus was only really identified in mid-January. So I do think that there is an opportunity to consider what could be done to accelerate opening of playgrounds, because we do want to encourage outdoor play. One, the weather is good. Now is the time to enjoy our outdoors. That's not to say the outdoors can't be enjoyed in the cold, but it has a certain kind of enjoyment, certainly in the summer, that we should try to take good advantage of. And second, we know that when it comes to surfaces, they are less of a concern than they might have been when we didn't know as much about the virus. So certainly having conversations all the time with our provincial counterparts. As you know, those playgrounds continue to be closed under provincial order still to this day. We'll continue to have those conversations, and hopefully, as we're progressing towards stage 3, we should see a restoration of our ability to use those facilities and to be able to enjoy the outdoors, where we know transmission of COVID-19 is definitely reduced.
And to that end, Francine, can I just mention again what I mentioned yesterday, which is that city staff have begun, because I think we have about 700 of these different playgrounds and play facilities, and we've begun the task of inspecting them to make sure that they're in good working order and safe for kids, so that when the day comes that we get into stage 3, which I don't think is that far away, we'll be ready to move quickly to reopen them without having to worry about the safety of those facilities, which have sat idle now for some time.
Is there any possibility that the playgrounds could open without us moving into stage 3 as a sort of exception to, to the rule of stage 3?
Well, I will only say that there have been instances in which these orders have been modified, but I think in this case, given the large number of playgrounds, it's the kind of thing, just as there are other elements of stage 3 that are quite numerous in terms of the number of places in a big city like ours that it affects, that it's unlikely they're going to consider that first. And frankly, I think our hope is, subject to the numbers and some of the concerns that Dr. de Villa expressed today, that the province is, as we speak, looking at ways in which we can move to stage 3 as soon as possible. So in a way, to invest an effort into having them do something sooner than when we might get a broader reopening, subject to some conditions, as Dr. de Villa discussed, I'm not sure would accomplish that much, but we're anxious to have things open up as quickly as possible, but as safely as possible, including playgrounds.
Thank you. We'll go next to Jake Cavanch from the Canadian Press. Jake, go ahead, please.
Hey there, Mayor Tory. I just want to follow up on the potential for masks being mandatory within apartment buildings. I've spoke to some of the companies who run many of the units here in Toronto today, and many of them seem to be very on board with the idea, but they don't seem to have any plans to implement a policy themselves. They said they would comply with a bylaw if it were put into place. So I guess my question for you was, earlier you mentioned that the City of Toronto will be doing a poster campaign. Do you see that being the point where the city's influence ends, or is there a potential for the city perhaps putting a policy in place for these buildings?
Well, I think given the concern that I've heard expressed about this from tenants around the city, and given the fact that we showed no hesitation after careful consideration and advice from public health to put a bylaw in place that deals with wearing face coverings on transit, and to put a bylaw in place that deals with face coverings in public indoor spaces, that if we don't see the kind of voluntary cooperation when it comes to private property, where we were both hesitant to move on private property because it's better if people who own that private property do that, and also because our legislative options are slightly more limited, but I will just tell you we'd have no hesitation, notwithstanding what I just said, to move forward and do whatever we could by way of a bylaw if that seemed to be necessary, and if we didn't get the kind of cooperation that we seem to be getting from the apartment association. So we'll see how they respond to the request we've made, but if we don't get adequate cooperation, then we have the opportunity to look at a bylaw in this area as well.
Amazing. I have no follow-up. Thank you so much.
Okay, Jake, thank you. We go next to Charisse Sucharan from the Globe and Mail. Charisse, go ahead, please.
Hi. So I was wondering, with the uptick in cases as well as the transmission coming from mostly larger gatherings of people, I was wondering if the city is currently prepared to do contact tracing required.
You broke up a bit there, Charisse. I think you're asking about contact tracing. We're prepared for that.
Yes.
I am. I'm asking if the city is prepared.
I think
Okay.
we got your question,
Yeah.
Charisse. We'll let Dr. de Villa answer, and then you can have a follow-up.
Sure. So a couple of things. You talked about large gatherings being responsible for the uptick in cases. And in fact, when we look at the major risk factors around what's giving rise to COVID-19 in our city, we know that it's close contact with cases, most of which comes from a household setting, not necessarily from a large gathering. That being said, we know that COVID-19 is the kind of virus that transmits well in environments that are closed or closed spaces, in crowds with close contact. So any situation that gives rise to those circumstances allows for the opportunity for COVID-19 to transmit. So those are the things I know we need to continue to look for, and that I would ask for people to seek to avoid. That's why we ask people to wash their hands, watch their distance, and to wear their masks. It's the counter to what we know are those conditions that allow for COVID-19 to spread. When it comes to case management and contact tracing, I'll just remind everybody that at the very outset of this outbreak, we had about 50 people within Toronto Public Health doing this kind of work. We are now in the range of about 600 or so, specifically doing contact management and case management, and contact follow-up. So we feel that we have certainly grown our workforce in order to manage the circumstances and to be sure that we are ready to address upticks in activities and surges in activity that we might expect as reopening occurs. That's what we've seen in other jurisdictions, so we should expect to see the same kind of thing here. I think as well we're continuing to train more people to do this kind of work so that we have those resources in place, that we have the surge capacity to be ready for reopening so that we can get our city back.
And follow-up, Charisse?
Thank you for the answer. I'm wondering if there's any updates on the contact tracing app.
So I do not have a specific update on the contact tracing app. Certainly, I know we were all looking forward to this. This was a venture that was taken on by the federal government in partnership with the provincial counterparts. I'm certainly happy to go and ask our provincial colleagues what is happening specifically on the app, but I don't have an update at this stage.
Okay, thank you. We go next to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, this is for Mayor Tory. The pandemic was cited as one of the reasons yesterday at the executive committee that city staff want to go with a sole source contract for the company called Pay It, which would allow people to have more services that they could pay for online. There was a reaction to tweets about that from people in the local tech community who say, you talk often about how Toronto's tech community is the best bar none, asking why not put it to a regular competition process and see if there could be as good or better solution from Toronto tech community instead of an American company.
Well, I think what we try to find is, regardless of the nationality of the company, and we certainly try to support our tech community as often as we can, but I think what we're trying to do is find a way in which we can move as quickly as possible to achieve increased digital service to our citizens. And what we did do in this case, while we didn't have a full-fledged competition, was to retain a consultant who looked at the field of companies, or a field, a pretty extensive field, as I understand it, of companies that could offer this service, and found that the one that could best get us into this as quickly as possible on the most reasonable terms possible for a period of time, it's a fixed term contract, would be the company that was approved in the report that now goes to City Council. So it's one of those things where there are many instances which we have used. For example, on traffic measurement, we've used Canadian technology with regard to some of the help we've given to small business during the pandemic. We've used Ritual, which is a proud Canadian success story. So I think we've really gone out of our way to try and use Canadian firms as often as possible, but we have to do in each case what we think is going to be best to move us forward as quickly as possible to achieve the desired result.
And the follow-up to that is the potential fees in the report on that talk about 2.35% for transactions onto credit cards. So if you paid, say, a $4,000 property tax bill on your credit card through an online transaction, the service fee would be $94. That sounds like it has to be one of the biggest single user fee transactions I can think of. I don't know about in Canada. Does that concern you that for convenience, people would be paying what seems like a lot of money for essentially a few clicks?
Well, you'd like to hope that these kinds of prices will continue to come down, and you'd like to make it as accessible as possible to people. But I also understand the fact that while it might get hidden, if we were to have developed a developed solution, for example, done inside the city government, first of all, I think it would have taken a lot longer. This thing has the prospect of being up and running very shortly. And secondly, the cost per transaction might have ended up just as high. And in fact, what I can tell you is that the cost per transaction, which to the city, which is paid for by the very same people, is going to dramatically be reduced by the availability of this service. So I think in the end, while there will be a charge for those who choose to use this, and they can choose, there will also be a saving for the taxpayers overall as we process a lot of payments at a cost less than would be the case to the taxpayers otherwise. So there are always, puts and takes in these kinds of things, but I think what you're going to end up with here is a service people can choose to use, as I believe they will in many numbers, and that they can do so in a way that improves service for them and reduces cost for the city.
Okay, thank you. Final question is to Miriam Medaya from Radio Canada. Miriam, go ahead, please.
Hello, can you hear me?
Yes, we can.
Perfect. So for Mayor Tory, my question to you is, some people were protesting today to ask you to provide more housing for homeless people and to stop relocating the encampments for the duration of the pandemic. Are you satisfied with how the city is managing the encampments throughout Toronto by removing them?
First of all, I will say that I think that the job that has been done by our public servants in our city staff organization in moving thousands of people to more physically distanced, appropriate accommodations during the course of the pandemic has been nothing short of incredible. It's been compassionate, it's been sensitive, it's been efficient, and I think it is a huge achievement for the city and for its public service, and I'm proud of how much they have accomplished. with respect to encampments, we have moved hundreds of people out of those encampments into other forms of housing. And yes, some of the places to which they've been moved have been temporary, but at the end of the day, where they have been moved is an improvement upon where they were, which was in encampments that were, I think, somewhat dangerous to themselves, certainly were not consistent with public safety and with public health. And also, they're inconsistent with our approach, which is very clear and very consistent, which is that encampments cannot be and must not be allowed to remain in places like public parks or Nathan Phillips Square or places like that indefinitely. And so we've adopted a sensitive, orderly, consistent approach, which is to give notice, to go and offer different forms of housing, which many hundreds of people have accepted, to move people to that housing and then take these encampments out. And that will continue to be the approach of the city government, because I think it is the right thing to do. It is the right way to handle this. It's sensitive, and yet it is consistent in its result, which is to move people to other housing and have these encampments taken down. And that will continue to be our approach.
And as a follow-up, some people at Moss Park, for instance, already expressed that they would stay. What is the city's response to that?
Well, as much as we've been respectful and tried to be very respectful of people's rights under the Charter, and of trying to understand, as we do, and certainly our staff do, the fact that there are some people who just don't want to go to almost any housing option we could offer to them, the point remains, the principle remains the case, which is that one place they cannot stay is in an encampment set up on a piece of public property like a park, or on the street, or in Nathan Phillips Square, to pick an example that we recently saw. And so we are going to adopt the same consistent and, I believe, sensitive approach, which is to go to people and to offer them alternate forms of housing, which we do consistently and sometimes with the same people more than once. And at a certain point in time, hopefully having housed as many of them as possible in satisfactory circumstances, those encampments will be removed.
Okay, thank you very much for joining us, everybody. Our next briefing will be this Monday, July 27th. Please stay safe.